So in our last lecture, we were discussing the medical system as an institution. In this lecture, we're going to compare the U.S. medical system to the systems used in other comparable countries. So many Americans assume we have the best healthcare system in the world, and up until about 1980, that was possibly true. However, we've lost a lot of ground to other comparable countries until in many categories we are the worst or near the bottom in terms of healthcare, particularly when you look at people on average, as opposed to, of course, the people, the wealthiest, who could afford the best healthcare. We tend to have higher rates of overall mortality, higher rates of infant mortality, higher rates of maternal mortality, that is mothers dying in birth, than most other, we would call, developed countries that are similar to us economically. Most other industrialized countries have some form of universal health care that is guaranteed by the state. So, for example, in Great Britain, after World War II, they set up the National Health System, the NHS. And this was set up in agreement between the Labour Party and the Conservative Party. And neither party is ever going to fiddle with the NHS. The only difference they might have is the amount of funding that they spend. So typically conservatives will try to restrict it. The Labour Party will try to expand it. But it's part of the philosophy of both parties. So under that system, all medical services, not all of them, there are private services obviously for people who want that, but there is a national system, a network of hospitals and doctors, clinics, etc., that you can go to. So every British citizen has a national health card, and with that card you go in, and if you're sick, you go into any doctor, any clinic, and of course, sometimes there you have to wait, or you have to go to maybe a clinic that's not right next to your house, or there might be delays, and things might not be perfect, but British people tend to prefer it to the American system. And most European countries have some similar type of system. Canada has another option which is called single payer. Under this option, medical services are private, so the hospitals, clinics, and doctors are private, but all the costs are paid by the government. So it's like the government is the national insurance company, and they therefore regulate the costs of services and pharmaceuticals. As a result, most hospital and doctor costs are lower, pharmaceuticals are lower, administrative costs are also a lot lower. So it's not like the doctors or the hospitals are poor, they're still surviving, they're making a profit, but they don't have to pay a huge amount for administrative overhead to handle a huge amount of paperwork related to having 20 or 30 different insurance companies with different policies. So, for example, the average person in Canada will pay $550 in administrative costs, versus in the US, the average person pays $2,500 just to administer their health care policy, if they have one. So basically it cuts out the insurance companies. So this is why people ask, does our healthcare system work? When you look at comparing to other similar countries, such as generally Western countries, you notice the United States does not have very good statistics. So for example, our health expectancy, our life expectancy is lower than most of the other industrialized countries, and only slightly higher than, for example, Cuba and Mexico, which pay a lot less for healthcare than we do. When you look at healthcare spending, on the other hand, notice that the United States has the highest amount of GDP spent for healthcare in the world. 17.7% of our GDP is spent on healthcare, compared with 9% in Australia and the UK. 11.6% is our closest competitor in France. When you look at even public healthcare spending, so remember the United States, we pay for the healthcare for poor people and for older people and some other people in between, but mostly the elderly and the poor. Our government spends 7.4% of GDP, which is comparable to every other advanced country in the world. But despite the fact that we spend so much more money and a larger percent of our GDP than any other country, 40 million Americans are completely uninsured. They have no insurance whatsoever. So as a result, they skip doctor visits and they skip medicines, and about 40,000 people estimated die every year because they do not take care of themselves because they don't have health insurance. But even with health insurance, we have a huge problem because there's typically a copay that people have to pay every time they see the doctor. Sometimes there's a minimum amount they have to spend out of pocket before the health insurance even kicks in. Sometimes you have to pay more if you're out of sector, if you're out of your insurance company's authorized list of care providers. So as a result, we tend to spend, even with health insurance, more than people in other countries spend, even when they go to private doctors. Another thing, insurance plans limit to access to doctors in plan. So very often, even though we supposedly have a free market system, in fact, we only have a very few number of doctors we can possibly go to, and therefore we have to maybe wait months to see a doctor. Particularly when we move to a new area, a lot of doctors don't want to accept new patients, or they don't want to accept a new healthcare insurance companies because they've already got so many different companies floating around with different types of paperwork. They don't want to deal with that problem. The paradox is, in America, only people on welfare have full coverage, because if you have Medicaid, it will pay for all of your expenses. But if you're middle class and you have insurance, if you get cancer or you have a major accident, that may still wipe you out. And if you don't have insurance, well, forget about it. So you would have to become eligible for Medicaid before the government will start to help you with your healthcare bills. It means you basically have to go bankrupt or lose or give away all of your property before you qualify. And approximately 2/3 of bankruptcies in America are partially caused by unexpected healthcare costs. So here's an example. In the US, if you have a fairly complex operation like a heart bypass, the average cost is $67,000. On the other hand, in other comparable countries, the average cost is only $21,000. For an MRI in the US, $1,100. The average cost in comparable countries is $480. In the US, for an intermediate operation like an appendix, it would be $13,000, $14,000. The comparable average cost in other countries is $3,200. Obviously, some higher and some lower. I had an appendix in Iraq. I had to have it taken out, and I was offered totally up-to-date technology, private hospital, latest techniques. Would cost me $1,500, $1,500, or about 1/10 of what I would pay in the US if I went to a private doctor or hospital. As a result of this, we have a whole industry where people go abroad for medical care or medical treatment or to get medicine. In fact, we are now in a situation where people routinely go to Mexico for dental care, for eye care, and to bring back medicine that they need, they cannot get in affordable in the United States. Or they go to Canada, or sometimes they get it from Europe. The problem is this is illegal. When you bring medicine in from abroad, you are breaking the law because these medicines have not been approved by the U.S. Drug Enforcement Administration, which regulates the drugs and the drugs used in the United States. So you are violating the law. You could go to prison. But we have a system in which now millions of people have to do this in order to survive. Now, every government has tried to come to some way to grips in some way or another with this healthcare situation we have in the United States. The last government to do so was President Obama, in about 10 years ago, and he set up a system called the ACA, but which most people know as Obamacare. And that Obamacare was a negatively derogatory way, Obama's going to take care of you, that was used to oppose it. However, it did pass, but only by watering down its provisions. So instead of really solving the problem, it simply minimized the problem. So even if it works perfectly, it will only reduce the number of uninsured people. It still relies on the same basic private health insurance system. And even the medical insurance that it provides very often is very erratic and sketchy, put it that way. But this is because there's always been a huge opposition to any change in the American medical system. When the United States first proposed a national health system after World War II, which was the system Europe was following, this was the problem. Europe had gone through a devastating war which left millions and millions, not only soldiers, but also civilians, physically traumatized. Cities had been bombed, countries had been fought over. So you had literally millions of casualties in those countries, and there was no way the private healthcare system could deal with that. So almost everybody supported the setting up of a national system or a state-sponsored system of healthcare in these countries, and it had very early support from doctors, from hospitals, from medical boards, and from conservatives, liberals, social democrats, labor parties. Basically came together, and it was seen as a part of the rebuilding of Europe after World War II. However, the United States was never really affected by World War II. We sent millions of troops abroad, certainly, and 500,000 American soldiers died in World War II, which of course doesn't really compare with what many European countries suffered. But virtually no American civilians were affected by World War II. The United States, besides Pearl Harbor, which was attacked on one occasion, we were never bombed, we were never occupied, well, outside of a few Alaskan islands, and we never had large numbers of civilian casualties. So people here said, well, we're doing fine. And doctors particularly opposed it because they felt it would reduce their earnings. So that's why they adopted this system of healthcare coverage through employers. So this created a massive healthcare system built around insurance companies and also pharmaceutical companies that now profit so much from this system that they refuse to let it go. After all, they are getting 17% of the U.S. economy. No other healthcare system in the world gets close to that. So the amount of money they're making in the U.S. is astronomical. They will fight every fight to prevent that from happening. The paradox is that for other companies, this is creating a huge problem. So businesses, industries cannot compete in the U.S. So nowadays, when companies go abroad, it isn't because of cheap wages. It's very often because they can get better health care for their employees without having to raise the price of an automobile by $2,000. Another factor which symbolic interactionists would bring up is, again, when you go back to American exceptionalism that we talked about in Section 2, Lecture 4, we have a strong history of distrust of government, of individualism. Americans don't like the idea of government making decisions for them. So whenever something like this comes up, it's very easy for interest groups to take this and say, oh, now the government's going to tell you what to do. They're going to tell you what doctor you can go to. And if grandma's sick, maybe the government will kill her so they don't have to pay for her health insurance. And in fact, these are the kinds of exaggerated claims about healthcare reforms that go around every time there's a debate. So one is that there's going to be death panels, administrators, bureaucrats are going to decide whether or not your grandma is going to live or die. Well, this is ridiculous. There's no death panel in any reform measure. The only thing that has been brought up is to say, okay, look, if there's somebody who is, for example, brain dead, and they're sitting on a machine that keeps them alive artificially, how do we make the decision to unplug them? It wouldn't be bureaucrats. The panels would be, there'd be a panel of doctors that would have to make sure that this was done in a proper way. And but you say death panels and government death panels, and everybody's like running around like chickens with their heads cut off. Another thing that people won't have any choice about their health care coverage. They won't be able to pick their own doctors and things like that. But this is already true with our current insurance plan system. So the reality is, if you have insurance in the U.S., unless you have some platinum system, most people have very limited options in terms of who they can go to. I remember very often calling up multiple doctors. Hey, can you help us? Can you get an appointment? No, we're not accepting new patients. No, we don't have an appointment until 3 months from now. No, we don't have this. No, we don't have that. So just to get into the system and meet a doctor became impossible. And that was a way of reducing their healthcare costs. Another argument, most Europeans hate their healthcare. Well, unfortunately, it's not true. Most Europeans love their system of healthcare and certainly would not swap it for the American system. Immigrants will come and get free healthcare. Again, Americans hate freeloaders. We hate the idea of people coming in and taking advantage of our generosity. Americans are very generous. We don't like people stealing from us, right? So that, again, becomes another big bugaboo, because also immigrants are very often seen as a group we don't want to be favoring. But the reality is, first of all, there are ways of dealing with that and preventing that, and usually it's because you have a national health card that would guarantee that only citizens or people with the proper credentials get the health care. But the biggest problem is the way people get care or take advantage of the system, if you want to call it that, is because they can't go anywhere else. They don't, if they're immigrants or, as I said, Americans who aren't poor enough to go on welfare, you can't go to the doctor, you limit your own health care, but if you do, you go to an emergency room, because emergency rooms are required to take care of people and then bill them. So you might go to the emergency room, maybe you have a cold, you have a flu, you have a scratch, you have whatever else, and then they'll give you a bill for $500 or $1,000, and of course, they're poor, they'll never pay it. So then the hospital turns around and then says, look, here are unpaid bills, we have to raise our costs or our prices in order to recoup these unpaid bills, or they get a funding from the government. The point is, there's no way of preventing this, and it doesn't matter whether or not we have a national health service. It's going to happen anyway. Another factor which is very important nowadays is what we call the anti-science movement. So sometimes this is pushed by religious people, sometimes just pushed by other people who don't really understand science and feel that medicine is a bit of a hoax, perhaps, right? Now, partly this is because they misunderstand the scientific process. As we talked about before in section 1, science is not about creating proofs. Science is about slowly gathering knowledge and improving our knowledge of the world. That knowledge is then used to create technology. So medical science usually involves understanding our biology better, how medicines work better, etc. And then the technology is applied to things like vaccines and pharmaceuticals and better surgical techniques and tools. But since people think it's, either it's mumbo jumbo or it's a mix of magic and fantasy, they don't necessarily understand how these things fit together, and they become very suspicious. So one of the most important medical advances in the last 3 centuries has been the use of vaccines that have literally saved millions and millions of lives. But one sign of this anti-science movement is an anti-vaccine movement. And the problem is, when you have a vaccine which is typically for a contagious disease, if a lot of people don't take the vaccine, they can get the disease and then spread it to others. Now, this is the problem. Some people can't take the vaccine because of whatever factors. Maybe they are not immune to the vaccine, so they're exempted. Okay, that's fine. As long as it's only a few people, as long as most people get the vaccine, that will protect everybody. But if you have a large number of people who refuse to take the vaccine just because they think it's bad, then you're going to start seeing the spread of these diseases, and it's going to impact people who otherwise are not able to get immunity. Typically, these arguments use religious arguments or pseudoscience arguments. They tend to focus on a very small number of problems that emerge. So, for example, if you vaccinate 100 million people, yes, a few of them are going to have side effects, right? And maybe 1 or 2 people have serious conditions. But you're protecting 100 million people against a disease that is horrible, right? And they ignore that. Or they focus on chemicals or trace chemicals in vaccines, like some vaccine may have minute amounts of mercury in it, or minute amounts of formaldehyde. It sounds terrible, mercury and formaldehyde, but if the amount you're talking about is equivalent to the amount you might eat on your breakfast table, right, we're not talking about an amount that's really going to do any amount of harm to anybody. And again, a misunderstanding of the logic of the scientific approach. So just to give a quick example, right? Smallpox used to kill millions of people every year. It was a disease that, as you can see by these fluctuations, every 3 years you would have an epidemic of smallpox. It would die down for a bit and then it would come back. It would die down, it would come back. This is from 1700 up until basically now. Now the thing is, in 1796, a guy named Edward Jenner developed a vaccine for smallpox. And this vaccine prevented people from getting smallpox. But as you can see, the amount of smallpox did not go down. Why? Because people refused to believe it. They refused to take it, and as a result, it had obviously no effect. If you don't take a vaccine, it's not going to be effective. But as you can see here, suddenly people got serious in the 1900s when other vaccines were shown to be effective. Suddenly people got serious about smallpox, and when they started applying it universally, it eliminated smallpox worldwide. Gone. But look at this. 150 years we had to wait for people to realize that this was actually a thing. And in the meantime, all these people dying or being scarred for life by smallpox. Polio also killed thousands of people, left tens of thousands of other people deformed. It used to be a regular thing in American cities that you would see cases of smallpox, and it was a very contagious. Jonas Salk, 1955, developed the first polio vaccine, and you can see the dramatic drop. So within about 10 years, polio cases dropped to 0. Until now, it's considered eradicated, right? But not before. So look at all this history of these people who died or were affected by smallpox. Polio. Measles is another disease that killed millions of people. This is just in the United States, the number of cases. And again, until 1963, there was no vaccine available. And then you see a dramatic drop in the number of measles cases as a result of the application of universal vaccines. All right, it's getting dark, it's getting late. I know this has been a very long lecture. Thank you very much for your patience. It's been long. I didn't want to cut this lecture in two. It's because everything fits together. So it's very hard to divide up in this particular case. But I hope you enjoyed it. I hope this inspired you to think differently about medicine in the future, whether or not you want to go into medicine or study medicine as a sociologist. You have a great day and see you later. Check the companion. Bye.